Hello, this is Dani Hartung sharing my final presentation regarding students with autism spectrum disorder. So we'll just dive right into the first part of this presentation, which is characteristics of students with autism spectrum disorder. While the theme of this presentation will be diversity and equity among students who don't all display the same generalized characteristics, it's important for us as teachers to anticipate general needs or likely needs for students who do fall on this spectrum. So the first thing that we'll look at is social relationships. We learned actually in one of the videos in this module that infants and babies can be tested for a likelihood for autism spectrum disorder based on whether or not their eyes can track eye contact of adults who are speaking with them. So what happens is they put the infant in front of a screen where another human adult person is speaking with them, and a computer electronically tracks the movement of their eyes. If the baby searches for and finds the eyes of the person on the screen, they are considered not to be at risk for autism spectrum disorder. However, if they can't track those eyes and they're looking at other places, that is a sign, an early sign that may indicate a child is at risk for autism spectrum disorder, because one of the characteristics in general is that these students do avoid eye contact and feel uncomfortable by direct eye contact with others. There's also some difficulty generally present with social reciprocity, meaning that if students are approached in a social setting, they may not be able to always recognize what it is that others are trying to communicate or to give that same social attention back in the way that it's expected. Nonverbal communication or interpretation of that communication can sometimes be difficult, which makes it hard for students to make and keep friends, especially in elementary grades, but that difficulty can last throughout life. And there is also a tendency to interpret others literally, meaning they don't necessarily all have this trouble, but students with autism spectrum disorder can often experience difficulty just distinguishing nuance or understanding sarcasm or figurative language, which we'll talk about a little bit later as well. In terms of communication from students with autism spectrum disorder, some will display few words, meaning that they don't tend to express their learning or their knowledge verbally. And this can sometimes make social interactions, again, a little bit difficult or just different because they don't always communicate in the same way that their peers do. Sometimes this can cause high anxiety for these students because they can realize that this is happening. They realize that they communicate or interpret things differently than their peers or the adults in their lives, and they don't want this to become the focal point of the conversation. No student wants to be the center of attention because the elephant in the room is that they maybe don't understand what's going on or don't see things the same way everyone else does. So it's important as teachers to be aware that this can cause high levels of distress in these students. Another point to note is that for students with autism spectrum disorder, stopping a task in the middle without completing it can be incredibly agitating. So for example, if you have some unstructured free time, which may seem like it would be cause low levels of stress for students, and a student with autism spectrum disorder is perhaps halfway through a puzzle or a game, and then immediately we try to transition into recess or to leave the room to go to specials class, this can cause high anxiety for that student because they can't compute or fathom that they have to make this abrupt transition and not finish the task that they started. So it's important to be aware, to communicate early on and explicitly that this transition is going to happen, and to make sure that students are comfortable and not distressed with that transition. Lots of students with autism spectrum disorder, not only do they really prefer routine and structure, they like things to fit in nice, neat boxes, but they also have tunnel vision in terms of their interests. So students can experience very limited interests where they go really, really in depth about those topics and know a lot about them. But this can sometimes cause a problem in the classroom or issues with teachers trying to cover specific content, because we do have to work a bit harder to help those students to kind of veer off of those narrow limited interests and over into whatever it is we're learning. This can be a powerful tool for learning though, or for integration, because we can try and apply these concepts that we're teaching to the whole group to those specific interests of the student with autism spectrum disorder in order to help them to retain and understand that information a little bit better. Because they are can be generally so fixated on these patterns and routines and limited areas of knowledge and interest, this can cause a little bit of stress for students, especially when they get pulled away from those things and thrown into group projects with high sensory overload likelihood. Students who get put into group projects that have large amounts of noise or sudden increased amounts of social interaction can be triggered immediately with high levels of distress because they're not used to that, they're uncomfortable with that, and so we have to be very empathetic and careful with tossing students into those situations, which for a neurotypical student might not be stressful at all. But for these students who experience symptoms of autism spectrum disorder, even on the side where it doesn't seem outwardly noticeable most of the time, it's critical for us to notice that these things might be huge social barriers for these students who do experience that. Um, these high levels of anxiety that students experience both socially and within academic settings can affect their families as well. So as teachers, it's important for us to have strong relationships with our students' families as well as the individual students, and we need to be empathetic and aware of the fact that sometimes parents, siblings, and other family members can be affected by the stress that is coming off of the student, perhaps when they come home from the day of school, if they're feeling severely agitated, or just this social expectation that a student act in a neurotypical way. If the parents are, maybe if the child is young or they haven't experienced other children with autism spectrum disorder, they may feel a little bit nervous about the whole classroom situation as well. So it's important that we meet them where their needs fall too. Diversity is a huge part of understanding students with autism spectrum disorder. One of my good friends always says her brother has autism spectrum disorder, falls somewhere on the spectrum, and she always says it's important to remember if you've met one person with autism, you've only met one person with autism. Just like the rest of us, anyone else in the world, there's a huge spectrum, there's a huge difference and distinction between individuals who have autism spectrum disorder. Personalities are different, needs are different, expectations, perspectives, and experiences are all different. So there's sort of this infinite number of combinations that could be happening, and you just can't put students in a box with a label and expect that they'll act any certain way, because they are all individuals who are different and need us to meet them where they are. There are different struggles and different ability levels, because remember, students with autism spectrum disorder may very well be highly intelligent and have high IQs. However, they just don't express that learning and that understanding in the same way. It's also an interesting fact to note that males are affected much more likely than females with autism spectrum disorder. So when we're maybe in lower elementary or early childhood development areas trying to diagnose whether or not a student will struggle with this, it's important to just know and keep in the back of our mind that males are more likely to be affected. Moving on to instructional supports for students with autism spectrum disorder. The first point to note is that we as teachers will need to be knowledgeable and able to respond to the behavior of students with autism spectrum disorder. I did learn through my research that there's a huge emphasis for these types of students that we use positive reinforcement strategies as punishment, or sort of putting a student down in their perspective can cause high levels of distress, even more so than what maybe a neurotypical student would experience by using punishment methods. We also need to be open to establishing alternative modes for completing assignments. This is huge in today's day and age because we can, of course, integrate technology. And one reason why we might do this is because some students with autism spectrum disorder can experience poor fine motor skill development. So where writing might be a difficult task, they might be able to speak into voice to text and more accurately give us an idea of what they've learned so that we can assess their levels of understanding. So not only does this decrease distress for the student, but it increases our ability to do our jobs and assess their learning. It's also important to use a positive approach to learning. So what that means is that we need to have these supports in place already. We can't just play reactive defense to students with autism spectrum disorder. We need to have several different options and modes for the students to demonstrate their learning, and for them to avoid distressing and agitating circumstances. So we need to have those supports already ready to go in the knowledge that we have a student with autism spectrum disorder coming into the classroom setting. In terms of social interactions, which is part of our job too as educators, we need to make sure that we give explicit instruction. Students with autism spectrum disorder have a very low likelihood of picking up on nuance or hints or sarcasm. So try to avoid the use of those types of things and give explicit instruction like we learned in this week's module, using social stories, visual schedules, things that are very tactile and concrete will help these types of students not only to understand the concepts, but to retain those routine things that you want them to learn over the course of a long period of time, even when they get distracted. Of course, for any student, particularly in lower elementary grades, it's hard for them to get those executive functioning skills. Growing up is hard work. We don't know how to take turns. We don't know how to wait for the next activity or to be flexible or to monitor our own behavior. Students with autism spectrum disorder experience this to an even higher degree. So this difficulty of controlling one's behavior or controlling one's outbursts or emotional feelings is hard for them because they don't always understand the social cues that are expected of them at their age level. So it's important to understand that when we throw them into these neurotypical settings, we can cause high levels of distress, but we can avoid those things by having supports in place, helping them to have healthy social interactions with their peers. We can continue to include these students in the whole classroom setting without causing high levels of distress. In order to communicate with students with autism spectrum disorder, again, we need to use explicit language, very, very clear instructions, step by step, and show them visually so that they can refer back to those very clear instructions later. In the same way that we have alternative methods for students to demonstrate learning, we also need to have alternative methods for them to communicate with us and for us to communicate with them. Things like boards or signs that they can easily access are very important. It's also important to note that some students with autism spectrum disorder do struggle with verbal communication, but others don't. So while some may be able to verbally tell you what they want you to know, others may use sign language or communication boards. And again, technology integration is huge here. So these are my references. I had an amazing time learning more about students with autism spectrum disorder. Even though in my 5th grade classroom, I don't currently have a student who falls on the spectrum that we know of, it's so important for me, even as a teacher or just as an adult moving through the world, to be more empathetic to these tendencies and these experiences of individuals with autism spectrum disorder. So thank you so much for listening. This has been my presentation for autism spectrum disorder students.